Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
The essence of becoming more efficient is gaining the ability to do or get more out of the same or less resources. You know, like producing more in the same or less time, or getting more new patients without spending more money, or collecting more while seeing the same or less patients. And this last example affects a metric you've probably heard of before: average transaction value, or ATV. It's commonly used in retail and other businesses to measure, the average value in dollars or whatever the local currency is of each individual sale or transaction. And this is one of those metrics that gets a ton of attention when analyzing a business or setting goals, primarily due to its effect on the business's bottom line. But despite its importance, you don't hear all that much about it in dentistry, which is unfortunate because it's an extremely useful metric for controlling profitability. And during times that are economically challenging, the ability to increase efficiency and profitability become all that more important. And that's what I want to talk about in this week's episode: 4 ways to increase your average transaction value. My name is Jeff Blumberg, and I'm your host. And I think the best place to start with all of this is to talk about exactly how you calculate your ATV, along with why it's such a big deal in every business, including a dental practice. So let's look at the normal way that this is calculated. The formula is real simple. It's total value of sales in dollars or whatever currency you're measuring it in, divided by the number of individual sales transactions. So let's say you have a clothing store and they have 100,000 of sales in a month. This 100,000 came in the form of 500 individual sales or transactions. That's so you take 100,000, you divide it by 500, and you get the number of $200 in this case, ATV, or average transaction value. All right, so let's say the store wants to increase its profitability. A key method behind that, beyond marking prices up or getting a better price from their supplier, would be to increase their ATV, or average transaction value. So what if we were able to sell a little bit more to each customer? Maybe not every single customer, maybe every other customer, and we got our ATV up to $250. Well, with the same number of customers, 500, our sales go to $125,000. We made an additional $25,000. So without all that much additional work, we made more. So how would we apply this to a dental practice? Well, a couple things. First off, calculating ATV in a dental practice, or average I keep saying ATV. I hope you're not thinking of like an ATV that you ride around on. They call it ATV, average transaction value, whatever. I'll stop. Anyway, but calculating it for a dental practice could be a little bit difficult in a couple senses. One, because you're looking at what would you be counting? That would be every time a patient comes in for a hygiene visit and pays, or if a patient gets a night guard, or if a patient gets a crown, or if a patient does an FMR, whatever it is that you're doing, right? But how do you count it? So let's say a patient comes in today, they agree to do 2 crowns, that's $2,000, let's say, and I'm expecting still $1,000 from insurance, but I only got 1,000 today. It gets a bit tough. It also doesn't account for no charge visits. So it'll account for that, visit where I'm prepping a crown, but it won't account for the visit where the patient's coming in and I'm delivering the crown, because that's a no charge visit. So, because ATV really doesn't account for people who don't buy anything in its normal method. And that's actually, if you're not tracking other metrics, that's where things can become a bit of a problem. I don't want to go too far off on this, but this is something to think with. So let's take that clothing store example I gave you earlier. So they had 500 sales and they made $100,000, right, for a $200 average transaction value. Great. Well, what if they had 5,000 customers walk through the door that month and only had 500 sales? Their conversion rate for sales was pretty terrible, wasn't it? And that doesn't show up in ATV, because ATV is only accounted for when somebody actually buys something. And you'd have other metrics to track how many people came into the store that month. But if you're not good at that, which, the bigger department stores are and the bigger retail chains are, but some businesses really, especially small business, don't account for all that, that well, and they miss out on that, and they're actually solving the wrong problem. You'll see this where, you might be sending out a marketing piece and you're not getting a lot of new patients from it. You think it's the problem's the marketing piece. Well, if you're not tracking the number of phone calls you got from that marketing piece, you may be handling the wrong thing. I send out a postcard, let's say, and I only get 10 new patients from it, but I was expecting more. But I missed the fact that I had 100 phone calls. So my problem is actually reception conversion in that case, as opposed to the promo piece. Do you track where I'm going with this? Anyway, so I would do it a little different in a dental practice because you want something simple. You don't want something that it takes an hour to calculate every week or 2 hours at the end of the month. So here's what I would do. An easier measurement for a dental practice would be average collections or average value per patient encounter or visit. Okay. So in other words, if you see 100 patients in a month and you collect $100,000, that would be $1,000 per patient. Now, some of those patients may have paid you nothing. It might have just been a crown delivery. Some of those patients were hygiene visits. Some of those were high value procedures. But this way you get an idea of the average per visit. And I would actually split this up a little bit. With doc and hygiene, like I'd keep 3 statistics to keep it real simple. I'd have it on the hygiene schedule and I'd have it on the doctor's schedule, especially in hygiene be useful too, because then I get an idea what's the average value of a hygiene visit, and I have it on the doctor's schedule as well, and then I could combine them for the practice. So let's say I have it for the doctor and I have the number there and I have the number for the hygienist. I have it there. Let's say for the practice, we're seeing an average of 20 visits a day and we're open 17 days this month and we collected $95,000. Okay, so our average value, $95,000 divided by 340 patient visits, is $279. And yes, okay, some of that money I collected this month was an AR, something that had been in my AR for 2 months, but it eventually averages out is the point, okay? You could also track metrics just as an aside, like production per day and production per hour for the doc and hygienist, because then this takes into account no-shows and things of that nature. But I'll stay on topic with this. We'll stick with this average transaction value. If you do it this way, dollar value per patient encounter, you'll have 1 or 2 month anomalies. If you get a big, humongous insurance check one month, maybe the insurance company hadn't paid you for 3 months. But on the average, it tends to average out, and you tend to see where you're at. All right. So now the real question then is, if that's how we're going to calculate it, how do you increase this number, especially in a healthcare environment? Because we want to do this right? We want to do this ethically. It's not like in a retail environment where we're getting somebody to buy another shirt, right, that they didn't need. That's not difficult. We're talking about a healthcare environment now. We have to do this right. So if someone's buying something, it has to be something that they actually validly need. All right. And for health reasons, right? Or it could be for function or aesthetic, right? It could be aesthetic reasons, but it's something that they actually need that's justifiable. So there's 4 basic ways we can increase this average transaction value in a dental practice. So let's take a look at those. First one is you would improve sales ability or sales skill, your sales conversion rate. So, I've given examples like this before, but let's say a patient comes in, they need 6 crowns, and you're not very skilled in getting them to really understand and want what they need. So you explain it to them, and let's say they have dental insurance and they go, well, doc, how much is the insurance going to pay? And they realize eventually that the insurance is only going to cover 2 of those crowns. So they only want to do the 2 now. And you don't really know what to do about that. So you end up doing 2 crowns this year, maybe 2 crowns next year, and 2 crowns the year after. Well, if you have the ability or skill to get them to understand why it is that they need this and want it, and they have opted for all 6 now, you probably wouldn't have to spend that much more time. Maybe it takes 20 minutes as opposed to 15, to do it right. So an extra 5-10 minutes. And you convert this to a 6 crown case instead of a 2 crown case. It's better for the patient. It's better for you, better career fulfillment, and it increases the average transaction value in the practice. You went from a $2,000 case or a $2,800 case to a $6,000 plus case just by spending a couple more minutes and having that skill or ability. Right? You also end up doing more quadrant dentistry, which is more fun and also more efficient, which I'll talk about here in a little bit. You also would have to make sure that you have the organizational side of sales accounted for in this instance if you wanted to increase this ATV. Let me give you an example. And there's lots of ideas I could give on this, but I just want to throw out some ideas so you can see that this is actually a possibility. Let's say, for example, you're getting a considerable number of new patients, and you find, let's say the new patients go to the hygienist. I'm talking about just straight up new patient initials. And you find that in a lot of cases, you go in there for your new patient exam, your initial exam, and you spend about 10, 15 minutes doing the exam. And for larger cases, you really don't have that much time to explain the case to the patient. You got like 5 or 10 minutes left at the end of the visit. So you try to do it. Maybe you turn it over to your treatment coordinator, but you really haven't had a chance to answer all the patient's questions yet or add that personal touch from you as the doctor. And you find that your conversion rate on these cases isn't very good. Or you're having to bring them back, which is fine. I've talked about this in other episodes before. But again, anytime you have to bring somebody back, you open the door to the possibility that they're not going to show. It also just adds time, right? Instead of closing this case today, we're waiting for 2-3 days or however long it takes to get the patient back. Well, in those cases, you could make a couple of efficiency adjustments. Let's say if your receptionist really was on the ball, and by on the ball, I don't mean, good. Obviously, they have to be good, but they really understood how to evaluate who was calling in. They could sort of determine what type of an appointment to set for this patient. We've had some clients add the option of having a 1.5 hour new patient initial versus a 1 hour initial. Meaning, let's say I call your practice and I say I'm looking for a new dentist. I just moved to the area and I want to get my teeth cleaned. And you ask me some questions, right? And we have a new patient intake form I'll put as a download on the episode webpage. And it has a lot of these questions in there. But you ask me some questions and you find out, let's say your normal new patient initial is about only an hour long. And you're only going to spend about 15 to 20 minutes in the room with me. The rest of the time is going to be your hygienist. But your receptionist asks me some questions and finds that, haven't been to the dentist in 10 years. I'm missing a couple teeth. I've got pain in a couple of my other teeth and I really want to get this stuff fixed and blah, blah, blah. So you're getting the idea, like I may have some serious dental problems that you're going to have to spend some time talking to me about. Well, if that's the case, your receptionist might go ahead and schedule me for this 1.5 hour new patient initial. So then the hygienist has done their number, right? They've done my perio probing and they've taken my full mouth and things like this. And then you come in, you do your exam. Well, you still have a half hour left in the appointment to discuss what you found, your findings, and the treatment plan, and go over me actually proceeding with the treatment plan. That can increase. So instead of having to bring them back for another visit, create another encounter, it increases your efficiency and you're able to get more done in less time. There are a lot of ideas like this. I'm just trying to throw this out here so you get the idea that this is actually possible. I'm telling you folks, this is actually possible. It's very possible to become more efficient and more profitable. And the cool thing about this is when you're able to sell better and you're able to be more efficient with regards to sales, it's not just better for you. It's not just better for your collections. It's really better for your patients. If we take that patient who needed 6 crowns and you're doing all 6 now versus 2 a year, that is better for them as far as their dental or oral health is concerned. Long term. If you push these other crowns off, more things can go wrong. Those could end up being root canals, right? Or other problems. So it's a good thing. It's good. Everybody truly wins in this scenario. One last thing I'll mention on this. If you do want to learn more about how to sell in a professional environment, get patients to want what they need. Sort of the premier service on this in the dental industry is MGE's Communication and Sales Seminars. You may have heard of these. They're called the ABC Seminars because there's 3 of them, seminars A, B, and C. I'll put a link to these in the on the episode webpage. You should definitely check these out. The average increase for an attendee is $288,000 in collections the first year. That is not a joke. Those are real metrics. But it's something you might want to check out because it makes life more fun for you and for your patients, believe it or not. All right, so that's number 1. Increase your sales. Number 2, address your fees or adjust your fees. This is sort of a no-brainer. If I'm charging, $10 for something and then all of a sudden I'm charging $15, I'm making more money for that something. It's sort of a no-brainer. I say this, but I still have run into people who have not changed their fees since 2020. I don't have to tell you about the inflation that's going on. You hear me talking about this. I don't want to sound like a broken record, but you need to raise your fees if you haven't already. And I warn you, because I've said this before too, if you don't, there are various fee surveys that give you an idea of what you should be charging in your area if you want to be sort of the median fee or a high fee or a low fee. The problem is these are not necessarily, they don't take into account the inflation that really took hold last September. And by last September, I mean September of 2021. I'm doing this at the end of 2022. So even if you do a fee survey and you find out, I should be charging, $850 for this procedure. If I were you, I'd probably add 10% just to account for the inflation for the last year. All right, just to be smart. So, instead of $850, it might go up to, $950, or maybe not $950, $925 or something of this nature to account for those additional increase. The other thing you can do to adjust your fees, and again, you're going to hate this because I talk about this all the time, is get out of PPOs, get out of PPOs. If you are in PPOs or any type of managed care and you're charging a reduced fee for your services, that is obviously going to affect your average transaction value and your profitability. Because as these costs have been going up, PPO reimbursements have not. So if you're not already on the way to getting out, please, 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 please start looking at how to do this. I can't stress this enough. Especially if you consider that a lot of practices have a lot of PPOs and it may take them a while to get out properly, because the last thing you want to do if you're 80% PPO is just drop them all immediately, like a hot potato. That could be problematic. You probably want to do it on a gradient scale, over time, but you have to start somewhere and you have to start sometime. So start now. We do have, again, I don't want to have too many, links or downloads, but we do something called a PPO exit strategy session. If you need to talk to somebody about to find out how to do this, I'll put a link on the episode webpage. We can work with you to kind of show you or guide you out of PPOs in order to have a more fee-for-service practice. Cool? All right. So that's number two. Number one, sales. Number two is fees. Number three, third method rather to increase your average transaction value is efficient scheduling. Now, obviously, with efficient scheduling, you can do more quadrant dentistry. If you have to prep 4 or 5 crowns, it's a lot easier to do that all in one appointment than to do it, one crown at a time. Because also, it's easier for you and for the patient because it's less encounters, right? It makes life easier, makes things more efficient, also increases that average transaction value. Other aspects of efficient scheduling would be proper double booking so that you're actually running efficiently. We talked about this a lot back in episodes 49 and 50 of the podcast. We also have a bunch of stuff on scheduling on DDS Success, our online platform, and we also do a seminar on it here at MGE if you want to find out more. But it's definitely a way to, scheduling, especially when we talk about efficiency, this is something we think of our schedules. You want to eliminate as much wasted effort as possible. Why do you have a good dental assistant? Because with a good dental assistant, you can be more productive. Same thing with if you have a good treatment coordinator. The doc has to participate less in the sales process and you still get a close, so it works. It allows the doctor to do more because the doctor is the highest value provider in the practice, right? So this is something you want to look at to make sure you're not wasting any time in your schedule and it has a degree of structure. All right, and last point, if you want to increase that average transaction value, is you increase the number of services you're capable of delivering. So let's look at this for a second, right? Especially because we're talking about healthcare here, folks. We're not talking about, I went into Nordstrom and they made me buy another shirt. Well, they didn't make me buy it, but they made me buy, they sold me another shirt. You have to, in healthcare, the person has to actually need it, right? So there possibly are procedures that you don't have the ability to do yet, which you could have the ability to do, which would be valuable to your patients. Maybe you have patients that need implants and you can't place implants, in which case you're referring these cases out. Or there are patients you meet that could use, FMR type services, but you can't do those or you're not confident in doing those. That's a service that if you learned how to do, you could add value to your average patient encounter, as well as help more people, which is really what this is more about, right? So this is something you can look at, and it's a funny thing because you'll see more clinical training is something that I think that most doctors can agree with. It's something that a lot of doctors will gravitate towards because that's why you got in the profession. You're a doctor. You like doing what you do. So learning to do new things is pretty cool. You also have to have the ability to support that practice-wise as well as the ability to sell it. I've seen lots of cases where you have an excellent clinician, great doctor, terrible business person, and can't sell. So they have all these services they could be providing, but they're not. So you want to balance these two things out, right? From a business perspective. But this is something you could look at. If you wanted to add value to your business and you find that you're referring out the placement of implants, maybe you can restore them. I would learn to place implants and get to the point where you're really confident with it. You feel that you're really good at it, in which case you just start doing it yourself at that point. You've added value to your business. You've also increased your average transaction value. To that end, last link I'm going to give you folks, we did partner with another group recently on an FMR course. It's actually great. We wanted a course for MGE clients specifically because what we found with a lot of CE courses is you had to go to a few to kind of get the knowledge that you need. So we put everything under one heading. It's an FMR program that we're going to be hosting here at MGE next April. I put a link to it on the episode webpage if you want to check it out. It is limited seating, and we have a lot of clients filling it up real fast. It's actually almost full last I checked, but figured I'd let you guys know. It is something to know. But just to give you an example of that, those are the type of things you can do, other procedures, other services. But be careful with this. The only warning I would give you is maybe you learned about some neat, new, cool procedure, but it's sort of niche, right? It covers a specific type of health situation or condition. I won't mention any, but a specific thing. But it's sort of out of the main line of what you do in your practice. I mean, you could even say things like clear aligner companies, right? Those are cool. They're great. They're a nice service. But it's one of these things where I've seen people go off the rails with clear aligners and they forget about doing the basic dentistry that they do in their practice. The problem with clear aligners, they're great, but the lab fees associated with them are usually pretty high as opposed to, doing just endo or operative. So you want to make sure that if you add services like this to your practice, you don't go, running off into that and forget about the rest of what you do in your practice that's made it successful. All right. And, I'm a big fan of recovering lost opportunities, in other words, taking whatever you have and getting the most out of it. And these are big ones. These points I'm talking about here in these 4 points that I was discussing here in this episode. I would look into these areas for yourself, have fun with it, and maybe make a resolution for 2023 to see if you can improve in these areas and increase your value per encounter. It's good for you. You're doing more for your patients, so it's also good for them. All right. That's all I have for you this week. Don't forget about the downloads. I also have all the links I discussed on the episode webpage. If you want any more info about MGE, you can find us at mgeonline.com or call us at 800-640-1140. Have a great week, and we will see you at the next episode.